So today we have a short time. We have less than 30 minutes right now. So the general plan is we prepped a few slides on this theme, Eat Smart, Move More, 5 takeaways for prostate cancer health. I'm thinking this might take us 10-ish to 15 minutes to just go through these slides and kind of give you updates. We tried to pick out latest current things, new things. We also brought the guides. You have that as a resource, a more comprehensive resource, hopefully. And then what we have done in the past, which I think works okay or works pretty well, sometimes there's a lot of questions and we only have like 15 minutes or so to get through them all. We're going to ask people to shout out the questions and we are going to write them down very quickly. We're going to take 2 minutes to do that. And then we will triage the questions so that we know how to answer things that are new and not in the booklets, perhaps, and then be able to tell you which things are likely in the booklets. Does that make sense? Seem reasonable to everyone? It seems to be the best way to go through a high volume of questions. Okay, with that, we'll get started. So as I said, we're doing this theme of 5 takeaways. So the first one here, if you have not heard from us before or others, there's accumulating evidence that exercise is beneficial for reducing the risk of all-cause death as well as prostate cancer-specific death. In fact, in 2018, the Health and Human Services, not American colleges, the American, what is it? It comes out from Health and Human Services. In 2018, the guide already recommended back then that for men with prostate cancer, regular physical activity was recommended to reduce the risk of prostate cancer-specific death. There have been accumulating evidence on this topic, such that this paper here was pulling data across 13 cohort studies and generally found that more versus less physical activity was associated with a 30% lower risk of prostate cancer or overall death. Prostate cancer death is, you don't have to know all the details, but on here, it's sort of the middle chunk here. You see the vertical line that goes to 1. 1 would mean no association. If you're over 1, positive association. If you're under 1, inverse, or in this case, what we would interpret as a beneficial association. So the big takeaway from looking at this graph, you can see all the studies are to the left of 1, meaning there was great consistency across all these studies for the benefits of physical activity on prostate cancer death, which is the 9 studies in the middle, or all-cause death, which was the smaller 4 up there. So this is something that we've worked on a long time. We published on this first back in 2011, Dr. Kenfield and myself. We continue to run studies in this. If you're interested, one of the flyers that we gave out talks about some studies aiming to help people improve diet quality and exercise. And we can talk more about that in a moment. Let's see, how does this go? Okay, so this slide is just summarizing. So now we've hopefully got you interested in keeping up your exercise, getting exercise, improving exercise. This is a summary slide from one of our colleagues up in Oregon Health Sciences, Carrie Winterstone. We've worked with her before. This is trying to give people a sense of, you should start from wherever you're at. You don't need to there's not an absolute goal. It's always about relative change for where you are at. So it's based on your ability. So that's how on the first column, kind of, are you inactive? If so, here's a recommendation on how to get started gradually, all the way up to people who are regularly active. What kind of goal should you strive for? And a quote from the paper from Dr. Winterstone, while moderate levels of resistance training are highly recommended, clinicians can reassure their patients with prostate cancer that exercise of any type, frequency, or duration at tolerable levels of intensity can have some overall benefit. One thing that's not reflected on this slide, you'll see that this slide recommends flexibility all the time, daily, for everybody. Some form of aerobic exercise, differing in intensity and frequency based on where you're at. Resistance training, again, usually striving for at least 2 days a week. And then balanced exercise. If you're you have more function and you're already pretty active, they would also recommend impact exercise. Impact literally means like jumping, so putting stress on your bones and your muscles. But jogging, running, and even walking is still are still forms of impact exercise. Walking would be considered low impact exercise. I was gonna say what's not on this slide though is high intensity interval training. You might have heard about this. It's kind of, very popular right now as a form of exercise. Some of our colleagues who work a lot in exercise oncology and focus on prostate cancer really do recommend HIIT training or high intensity interval training, which means short bursts of like high intensity, get your heart rate up to the, moderate, high vigorous level, 90%-ish. So like 30, you could start with like 30 seconds and then going down for a rest for a minute and then doing those intervals. You could, start with maybe doing that 3 times and then work your way up to like 7 times. Okay, just to give you a sense of what that means. But if you have more questions on it, we can answer later.
Okay, our next topic is diet. And so this was a study that Dr. Chan and I were involved with Dr. Wang. We looked at diet within the multi-ethnic cohort study. This is a large cohort study of 215,000 people. It was started back in 1993. You'll see with the pie chart on the right, it's a very diverse group. So you can see all of the races and ethnicities captured in this cohort study. It's the most diverse cohort throughout the United States. So we were really excited to look at these dietary indices and patterns within this study. So we explored 16 different scores in this study of men with prostate cancer. There's 3 scores that were associated with all-cause death or CVD-related mortality. They're listed here on the slide. Unfortunately, we saw no association with any of the scores or indices with prostate cancer-specific death. We did look among the different race and ethnic groups. There were enough people in this study to be able to do that. This is the first time that's been able to be done. And we did see a benefit for the 2021 prostate behavior score. We'll speak more about what's in that score, only among those who were identified as African American. And that benefit was large. It was about a 50% decreased risk with every increase in point of that score. So another takeaway from this paper is that many of these scores and indices were developed in primarily white men in the existing cohorts. And so there's a lot more work to be done to explore what other patterns and indices might be important for more diverse and specific subgroups of people. This is another paper that we published recently. Vivian Liu led this. She was a master's student in our group. We looked at the plant-based diet index in the capture cohort. This was started by Dr. Carroll at UCSF. It included over 46 urology practices across the US. This was an index using data from Harvard initially. We applied the same index to the capture cohort and looked at those who had high levels of a plant-based diet versus very low levels. And doing that comparison, we saw that those with the highest levels had about a 47% lower risk of prostate cancer progression. There's also something called the healthy plant-based diet index, and that is just giving more points to those plants that are healthier. So things like sugar sweetened beverages and potatoes and sweets got lower scores. And with that diet, we looked at aggressiveness of prostate cancer at diagnosis and saw that those with a Gleason grade of 7 or higher had a 55% lower risk of progression. I wanted to just highlight other work we've done on plant-based diets with other colleagues. So Dr. Loeb led a study on the plant-based diet index with incident lethal prostate cancer. This study was done in the Health Professionals Follow-up Study at Harvard. We saw also with a higher plant-based diet intake, a 19% lower risk of fatal prostate cancer. This second study was also done in the same cohort, looking at this index with quality of life in men with prostate cancer. We saw those with the higher plant intakes had better sexual function, urinary outcomes, and hormonal and vitality outcomes. We are pursuing the same analysis and capture currently, and hopefully we can share those details with you next year. Okay, number 4. This is a good segue from the last slide because this study was done in 3 cohorts: the Nurses Health Study 1 and 2, and the Health Professionals Follow-up Study among 221,000 people. The investigators were interested in understanding the association between butter and risk of death, and healthy plant oils and risk of death. So they took the people that had the highest levels of butter, comparing them to the lowest levels of butter, and they saw a 15% higher risk of total mortality in the people that they ate the most butter. Now you may be wondering, what level is that? So the people that had that highest level were eating about 1.5 tablespoons a day versus less than a teaspoon a day of butter. And then they also looked at total plant-based oils and saw this 16% lower risk of total mortality. And so these are people that are eating about 2 tablespoons of olive oil versus very little. They also looked at substituting butter for plant-based oils like canola, soybean, and olive oil, and saw that substituting 10 grams per day of butter with an equivalent amount of olive oil or other plant-based oils resulted in a 17% lower risk of total mortality and a similar amount for cancer mortality. So I hope everyone understands what the take-home message was of these 2 slides. Focus on plants, and if you can, remove the butter from your diet and replace it with healthy plant oils. I guess I'm up again. So this is a project that we are currently working on, understanding all of the indices and scores that have been published in men with prostate cancer for 3 outcomes: prostate cancer specific death or progression, CVD related mortality, and all-cause mortality. There are many other, as you heard from the first slide, in the multi-ethnic cohort study, there were 16, right, that were reviewed in that analysis. So these are the 7 that have been associated with any of those outcomes that are beneficial. We can go over the details of these scores. The 2015 score means that it was actually developed by our group in 2015. We developed another score in 2021, looking at the evidence again. And then the ACS is the American Cancer Society score. The WCRF AICR is the World Cancer Research Fund, American Institute for Cancer Research score. And then you may have heard of these other patterns. We already talked about the plant-based diet index. You can see that many of these patterns are associated with all-cause mortality. So these are beneficial and lower risk of all-cause mortality. A few of these, the top 3 on the left, have been associated with better or lower prostate cancer specific mortality or progression. And then the one score that stands out, the 2021 prostate score, has been associated with all 3 outcomes.
Okay, so the converse of that, in studying these patterns, these are highlighting some of the patterns that you would not want to follow, limit, or avoid. The patterns themselves are labeled as the Western dietary pattern or inflammatory pattern, dietary pattern. In terms of what foods are reflected in these patterns, they're very overlapping, actually. And so a takeaway is really, foods such as red meat, highly processed foods, sugar-sweetened beverages, refined grains, high salt foods, again, with the processing. Those foods would all fall under the Western dietary pattern or pro-inflammatory foods, and those would be not recommended, or you'd be recommended to limit or avoid those. So those are the ones that were associated adversely with those outcomes.
So I put this slide together to pull it all together to represent all of the different diet indices and lifestyle scores from the last 2 slides. We have a long list of things to do for your health, as well as to limit or avoid. So you can read this list. I want to focus on the prostate specific foods, eating tomatoes, fish, limited wine is okay, with the caveat that the American Heart Association does not recommend drinking wine to gain potential health benefits. To limit or avoid, for prostate specifically, avoid processed meat, limit your saturated fat, including whole milk specifically. And then finally, I just want to highlight these three things. So if you were to do anything after today, I would recommend these three things at the top. So one, eat more plants. Try to eat at least one salad a day. I think that's an easy way to get plants into your diet. So if you didn't eat a salad for lunch, eat one for dinner. You have 2 chances. Second, find healthy substitutes that you enjoy compared to the less healthy ones. So there's a whole list of things to limit or avoid. There's so many good options to replace those foods with. Find ones that you enjoy. And then finally, make exercise a must-do. Really focus on resistance training. I think that's mentioned less often, but it's very important for people with prostate cancer, especially on hormone therapy, to do exercise that improves your muscle mass and bone mass. So that's it.
Okay, we threw this in here just to be topical, and we thought there could be questions on it. So GLP-1 receptor agonists, as people know, these are that class of new weight loss drugs, like Ozempic, for example. And so there's a lot of interest in the scientific community about potential benefits of these drugs for other indications, such as cancer, including prostate cancer. Just to set the context, though, these drugs are relatively new. So in going back to the literature and seeing what has been published to date, people have looked in the studies that were conducted in people with diabetes, where they were testing these drugs in the first place, to look at cancer outcomes. So what I'm showing here is a summation across, I think, 5 studies, where the main study was testing the new diabetes drug against traditional diabetes drugs. And so these are secondary data analysis where then people went back in and went to see, oh, how did they do with respect to a cancer outcome such as prostate? So it's kind of interesting. You can see, again, the studies are all to the left of one, suggesting that there was a lower risk of developing prostate cancer in those people who are randomized to the GLP-1 receptor agonist versus other types of medication for diabetes. So it's compelling. There's not yet studies in human patients who have prostate cancer looking at the effects of these drugs yet. There's some interesting preclinical studies, like in cell lines in the laboratory, about potential anti-tumor effects, but I think there'll be more to come in the future years. And I just listed here some context. So in case people weren't aware, in some studies, diabetes has been inversely associated in the past with the risk of getting prostate cancer. However, if you have diabetes and then you get diagnosed with prostate cancer, those people tend to have worse prostate cancer specific outcomes than people who don't have diabetes, which is kind of a complicated inverse finding, right, than what you would expect. So just put this up here. I think it's interesting, but more to come on that. Okay, so lastly, again, if you came in late, there are booklets in the back. We just wanted to make you aware of these resources. So the QR code right here is to a whole list of PDF guides. We brought 2 of the ones or 3 of the ones that are in the website, but if you take down or take a picture of this slide, you can use these QR codes to get to a whole slew of the different types of guides that we have created around diet and exercise and other health behaviors to improve cancer survivorship. We wanted people to be aware. We have 2 open studies that are enrolling, open to people with cancer and specifically men with prostate cancer. Eat, Move, Sleep is open to people with bladder, colorectal, kidney, or prostate cancer. It's an observational cohort study, survey-based study. We'll ask a lot of questions about diet and exercise, integrative medicine, and permission to access medical records for long-term follow-up. It's to help us learn more about, more contemporary foods, more contemporary practices in contemporary patients, with the current treatments. A lot of the studies that we cited, they're great resources, and we've done a lot of important analyses, but they have been done decades ago. So it's important to sort of keep up with contemporary clinical practices. Tools to be fit is a randomized controlled trial. This study is specifically designed to test different combinations of tools, such as text messaging, Fitbits, coaching, other tools, that's what tools mean, to help patients make the healthy diet and exercise changes that we have been talking about. So in that study, you have a 15 out of 16 chance of being randomized to a set of tools where you will get that for a year, right? For 1 year. So if you're interested, you know, those are how to sign up to get more information and sign up.
The material.
We put flyers for both of the studies in the materials. Okay, questions? You gotta shout it out. Just shout it out.
You talk about pecans, cashews,
Okay, nuts.
different kinds of nuts,
Okay, other
What?
questions?
Coconut oil,
Okay.
canola
Eggs.
oil,
Low-fat dairy.
fish.
June, can you mention to the
Eggs.
audio that questions will get repeated? Yes,
Yeah.
because people are
We'll
online.
repeat.
is it milk or dairy to avoid?
You said milk or dairy?
Have you looked at the big EPIC study in Europe that doesn't show any correlation between food and prostate cancer?
We'll comment on that. Okay. anything-
Vegan versus just vegetable. I mean.
Okay, so, yep. Anything else?
Eating whole pomegranates.
You mean like the,
Not the skin.
yeah, I was gonna say, not the skin. Okay.
Versus juice.
Yeah, right. Okay. Okay.
Does resistance training increase?
Okay. Aiden, did you get any online? Okay, Aiden's also got online. Okay, let's see. Nuts are beneficial. Details are in the book about different types of nuts, if it's not in there specifically. Oh, yeah, sorry. Okay, sorry about that. So nuts are overall are beneficial. Specific types of nuts, I think we cover that in the booklet. So we're trying to triage what's in there versus not. The question was about the benefits of nuts, and I think I heard pecans versus other types of nuts.
Yeah, pecan.
Pecans versus cashews. Off the top of my head, I actually don't know. So I would recommend to look in the guide. So we publish those guides with the registered dietitian who works with cancer patients here at UCSF. Coconut oil, while it is a plant-based oil, is high in saturated fat and would not be recommended versus other types of oil like avocado, canola, olive oil. If you buy a jar of one way to tell, right? You buy a jar of coconut oil, it's solid at room temperature, like butter, as opposed to liquid. So sparingly, it can bring good flavor for
MCT
baking.
oil?
What was it?
Medium chain triglyceride oil?
Yeah, I don't have specific data for that medium chain triglyceride oil. Okay. Canola would be considered a beneficial oil in the same category, like olive oil and avocado. We would generally recommend low-fat dairy if you are going to eat dairy at all. Do you want to?
Yeah, we published many studies now on dairy. The finding that keeps coming up is whole milk. So at 4 cups of whole milk, is it a day, June? I think it's a day. The whole. For dairy, we've looked at total dairy, and it's 3 servings a day of total dairy have increased risk. It has looked like it's the whole fat dairy that's problematic, not the low fat dairy. So we say it's okay to have low fat dairy. We recommend 3 or less servings per day based on that study in the Physicians Health Study.
I think there's a general question on the same topic of milk versus dairy. So assuming you mean like cow milk, we would recommend, I mean, if you're gonna have to have milk, we would first say like, go for skim, lower fat, as opposed to the higher fat, based on what Dr. Kenfield just said. We would also recommend considering other alternative milks like the almond milk and oat milk and things like that if you're using it in your coffee instead of dairy, given what she just summarized. Cheese is high in saturated fat. Non-fat, low-fat yogurt can be a good source for protein. But again, watch the fat intake for that. Okay. Fish, what was the specific question about fish?
You were saying the benefits of plant-based diet, but
Oh.
fish could be incorporated as part of that.
We have included fish in our studies. Yes, sorry. The question was, is fish beneficial? Is that right? So we have incorporated fish. It was in Prostate 8. If you got the magnet, we recommended 2 servings a week of fish. Fatty fish is best, like salmon, mackerel, trout. If you eat fish. So I would say eating fish is beneficial, and we would recommend it for men with prostate cancer.
Okay, there was a question about specifically the EPIC European cohort studies in general, and there is also a question from online about, are any of the studies we published on from randomized controlled trials? That's a great question. There, first, let's see. In the epidemiologic literature in general, most of what we presented on today and what the recommendations are based on are from observational studies. It is possible that the EPIC had a null finding for prostate cancer. I'm not remembering specifically off the top of my head which paper that is, but someone can write to us after if you want to have a specific question about that. How do these observational studies adjust for confounding factors? Most of the studies, at least that we work on, have also asked about exercise and weight and smoking and as many of the lifestyle or social factors that one can, so that they are included in the models. We only call something statistically significant as a finding after due diligence on trying to adjust for many of the confounding factors that we could have in those studies. That being said, are there studies for exercise? There have been some completed randomized controlled trials of exercise. Smaller studies, short term, but for example, the ERASE trial that was done in men on active surveillance did see a benefit in PSA with 12 weeks of high intensity interval training versus a control group.
Do you want to talk about your study?
Oh, yeah. Our active surveillance exercise study here at UCSF, we did see our main finding was to see if a remote intervention would improve fitness. It was a walking-based intervention. If any of you participated, thank you very much. We did see that the intervention was effective at increasing cardiorespiratory fitness by 14%, which was over what we were aiming for in 16 weeks. There have been studies looking that have shown a benefit of higher cardiorespiratory fitness, lower prostate cancer specific progression and death outcomes. Randomized controlled trial, there have been a couple other diet/lifestyle studies, mostly though with intermediate outcomes, right? Prostate cancer has a long natural arc, and so it's actually hard to follow for a progression, death, metastasis outcome. Most of the studies have been like shorter term, looking at maybe say changes in PSA, changes in other biomarkers, but would generally support what we have seen from the observational research. They don't always pan out though, because of adherence differences, meaning people can't stick to that diet. Okay, let's see. Are there any antioxidants such as lycopene that are especially effective against prostate cancer progression? You want to answer that?
Any others other than lycopene?
No, any others like lycopene. They're especially beneficial. I think that kind of goes, so we would generally recommend whole foods rather than a specific supplement, just to be clear. So try to get all your nutrition if you can from eating the wide variety of fruits and vegetables. Someone asked about pomegranates. Pomegranates, they are high in specific antioxidants, but the juice is high with sugar because to make it palatable, you have to add a lot of sugar. So we would recommend eating the whole fruit for sure, but not necessarily the juice. Okay. You want to do vegan versus vegetarian?
We have not looked at vegan diets with progression or prostate cancer specific mortality. Even in the plant-based diet that I talked about in Capture, there were very few vegans. So less than 2% were vegans in that study. So it's very hard to look at that as an exposure.
But I guess to say in the plant-based dietary index, that's looking at where they're seeing a benefit, right? Just to be clear, plant-based dietary index doesn't mean that you don't eat other foods. So that is, so those benefits are seen in people who might be omnivores, but are eating a lot of plants. So I guess maybe a way to translate that is, do eat a lot of plants, fruits and vegetables, whole grains in your diet, but if you are eating meat, it might be okay. We've seen benefits for eating fish in some earlier studies, as Dr. Kenfield referred to earlier. So, but we don't have enough data to distinguish between the benefits of a vegan versus vegetarian, I guess, if that was the specific question.
And we still recommend people to eat different sources of animal lean protein. So we tell people they can eat lean chicken without the skin, turkey.
There's
Yeah.
another, I heard a shout out. What was it?
Oh, the question was vegan versus,
Vegetarian.
pescatarian, say. Lots
Yeah,
of vegetables, but.
We don't have any data to suggest that that would uniquely be better at this moment in time. The question was vegan versus high vegetable and fish. There's not data to say that vegan would necessarily be better. We don't know, but okay. The thing we've got through most of it, I know we're a few minutes past time. There were two questions. Do you want to talk about myokines? So there's someone asked about Rob Newton's study in Australia. I think Dr. Kenfield's actually a co-author on that paper. So
I published 2 studies with Rob Newton on myokines after exercise. So we published one in the GAP4 study of men with metastatic prostate cancer, showing that myokines, the serum from people that are exercising prevents growth in prostate cancer cell lines. And he also did another study looking at people who exercised vigorously for a short bout, and he took serum before and after that exercise, and 30 minutes after that time point after the exercise, and saw a spike basically in the myokines that went down to normal after 30 minutes. And so based on these data, Rob is recommending that people break up their resistance training over the week so that you get that myokine spike after your workout 3 to 5 times a week. So instead of doing 2 days of resistance, whole body resistance exercise, say Tuesday and Saturday, do a lower body session, then an upper body session the next day, then a lower body session, then an upper body session. So you give your muscles at least 48 hours to rest. And that way you get at least 4 myokine spikes if you're exercising 4 days. So that's what I would recommend currently.
okay, and there was a question about GLP-1, but I think I hopefully answered it with the slide. We should let the next speakers go. We'll maybe you can find us in the back or outside of the hall if there's still questions. Thank you so much. This is an area we've worked on a lot here at UCSF. I was literally recruited here out of my postdoc to work on diet and exercise and prostate cancer 25 years ago. So we're very happy to still be chugging along and trying to contribute to the literature. Thank you so much for your interest and attention.